Because you clicked on this video, it is likely you have had first-hand experience on how excruciating and frustrating back pain can be. And what is more frustrating is the experience of going to see your doctor that you are in need of help, only to be told to rest and take some meds and come back in a month's time if the pain persists. My name is Nurse Fortune, and on this channel we talk about nursing and health. And in today's video, we'll be discussing the 7 worrying signs that your back pain is caused by an underlying condition. So stay tuned to the end of this video. Low back pain is very common, and about 4 in every 5 persons will experience back pain at a certain point in their life. Some will be able to identify their triggers for their back pain, maybe heavy lifting, standing up for too long, and for some, the cause of their back pain might not be known. Low back pain can be very frustrating as it can stop you from going to work and going out with your friends. But the good news is most back pain gets better with time, so you don't have to worry too much about your back pain. The causes of back pain can be divided into 2 categories. We have the musculoskeletal back pain and we have the pathological back pain. Our low back is a complex structure and it is made up of bones, muscles, nerves, and other tissues that helps us move. The bones of the back are called vertebrae, and these vertebrae are stacked on one another and they form the spinal column. And within the spinal column is the spinal cord. The spinal cord is a thick bundle of nerve that has a direct connection to the brain. And from this bundle of nerves are small nerves that have to squeeze through tight spaces between each vertebrae to reach tissues and organs. Musculoskeletal back pain is caused by strain of one of these many joints, ligaments, tendon, and muscles in the lower back. Because of the great number of nerves that run in our lower back, even a slight injury to these structures can cause excruciating pain. And because these structures are close to each other, it may be difficult to pinpoint the exact source of the injury. Musculoskeletal back pain is the most common type of back pain, and it is a type you shouldn't worry about because musculoskeletal back pain improves with physiotherapy, pain medication, and most importantly, time. Then this brings me to the top 7 warning signs of your back pain. The first one is duration of pain. Pain caused by pathological conditions such as infection, cancer, fractures, autoimmune diseases, and nerve damage accounts to about 1% of all people who complain about their back pain. And if your pain should persist beyond 6 weeks, it could be a sign that a condition or an underlying condition is at play. The second worrying sign is the progressive escalation of the severity of pain. With musculoskeletal back pain, many people will experience fluctuating symptoms. Some days the back will feel quite good, and another day it will feel very worse. Pain from pathological conditions does not behave this way. Once a problem has occurred, it continues to stay that way and it usually gets worse. The back pain that turns up and continues to escalate over time is a sign that there could be an underlying disease process. So if a pain should continue for more than 6 weeks, an underlying condition might be at play. The third sign of a worrying back pain is fever. If your back pain is accompanied with fever or night sweat, although infections that cause back pain are rare, but they can occur in people that are using drugs, such as injecting drugs, people who use immunosuppressant medications, and those people who live in the area where infections like tuberculosis are common, because tuberculosis has a way of affecting the joints in the body. And earlier we explained that the spinal vertebrae is made up of joints, ligaments, muscles that are stacked up on each other. The fourth sign are in the people over the age of 50 who have developed a new back pain. With increase in age, problems like cancer, fracture become more likely, especially in women, due to the fact that there's a significant reduction in bone density due to menopause, putting them in higher risks of back pain. The fifth sign is back pain accompanied with an unexpected rate of weight loss. That is because weight loss can be a side effect of cancer. And cancer is an uncontrolled growth of cell. And this cell can suck up the energy and cause people to lose weight. So if you notice your back pain comes with an unexplained amount of weight loss, ensure you seek or consult a medical practitioner. The sixth sign are in people that experience severe spine stiffness, and this is caused by an autoimmune condition known as ankylosing spondylitis that causes fusion of the vertebrae and leads to restriction of the spine movement. This condition makes life very difficult, and it is important for doctors to diagnose it as early as possible. This condition is very common in the aged people, whereby their back will be bent and it will be very, very stiff and painful. The seventh sign that can make you worry about your back pain is if there's an evidence of nerve damage. And in conditions like these, symptoms like urinary incontinence, constipation, numbness around the genitals are common. And in less severe condition, there might be changes in sensation and weakness in the leg movement. This indicates that the bundle of nerves running through the spine may have been injured all along, and it might be due to either compression of the spinal cord or disc bulge. And in this bulge, physical therapy can be done, but in compression of the spinal cord, an urgent surgery is needed. One thing to remember is these 7 signs are not the absolute sign or indicators for a serious back pain. So if you have either one of these signs, please stay calm and go for medical checkup. So I hope you've enjoyed this video. Please don't forget to like, subscribe and turn on the notification bell so you don't miss amazing content from this channel. And if you want to see me answer different medical questions on the internet, click this video right here. And I hope to see you all in my next video. Bye.